Hello and welcome to the chronic kidney disease presentation. And this is largely based on an article from Dr. Michael Greger from nutritionfacts.org, which I found helpful, reducing acid-forming proteins, which will protect kidney function. I think if you speak to most nephrologists, most kidney doctors, they say a few things in common, such as drink lots of water, minimize the use of anti-inflammatory drugs like ibuprofen, and reduce the protein load on the kidneys, especially animal proteins. Chronic kidney disease is a big problem, and probably most patients with it don't know they have it because until the late stages, it gives you no symptoms. So it's typically picked up on a blood test from your doctor. Diet plays a role in so much of our health, including kidney function decline. And as I mentioned, diets high in animal proteins are just tougher for the kidneys to process and may accelerate kidney dysfunction. Especially in today's industrialized society, we're eating a lot of processed food, also known as unnatural food. And these high saturated fat, sugary, salty foods can be tough on the kidneys because they're acidic, and a more plant-based, plant-forward, basic diet is easier on the kidneys. So, with this in mind, we want to reduce the dietary acid load from foods such as meat, eggs, and cheese. High dietary acid diets full of animal protein cause our kidneys to produce a lot of ammonia as a protective measure, which is beneficial in the short term to buffer out the acid. However, in the long term, all of the extra ammonia seems to exert some toxic effects. Kidney function naturally seems to decline as we get older, and by the 80s, maybe we only have half of our function left, which is plenty. However, if you are harming your kidneys through frequent use of anti-inflammatory drugs or a high acid load diet or decreased water intake and dehydrating the kidneys, then you may not have half, you may have a quarter or less of your kidney function as you get older. So, switching over from what to eat less of to what to eat more of. More plant foods. Plant foods not only have more of a basic load, but they also contain thousands of substances like anthocyanins and antioxidants that fight free radicals and reduce oxidative damage. We want to consume more fruits and vegetables. Fruits and vegetables are going to be low in acid, and like a lot of plants, fruits and vegetables contain lots of antioxidants, thousands of things in each fruit and vegetable that can help with kidney disease and alkalinizing the urine. We know that protein derived from plant foods is accompanied by antioxidants that fight free radicals and reduce oxidative damage. Plant protein is also more basic, less acid forming in the first place, because it has fewer sulfur-containing amino acids. American diets are largely acid-producing because they're largely deficient in fruits and vegetables. And we replace those missing fruits and vegetables with a lot of animal products, which increases the acid load due to the sulfur-containing components. So changing from a standard American diet, the SAD diet, to a plant-forward diet may improve acidosis in those patients with chronic kidney disease. A vegetarian diet is alkalinizing, the opposite of acid-producing. This is true even of vegetarians who consume processed meat replacements such as veggie burgers, which I don't think are healthy. They're a great treat and a great vegan option, but really stick to a whole food, plant-forward diet with lots of fruits, vegetables, and beans. We've known this for decades. Plant-based diets have been prescribed by nephrologists for chronic kidney disease for years. They contain no fat, no cholesterol. They're less acidic. They lower blood pressure, which in yet another way reduces the stress on the kidneys. Getting away from animal products for a moment, there are some non-animal products that you need to avoid, such as diet sodas. In this study, patients who drank 2 or more diet sodas a day had a measurable decline in their kidney function. There's a supplement you can purchase at any super supplement store or online called nicotinamide mononucleotide, also known as NMN, that when given to mice in this study showed that it protected against kidney damage. Another important toxin to be aware of in regards to the kidneys is sodium. And sodium exerts direct toxic effects on the kidneys. It also raises blood pressure, thus indirectly impacting the kidneys. Limit sodium to less than 2 grams per day. A great calculation you can use to estimate how much protein you need to function is 0.6 to 0.8 grams per kilogram of ideal body weight per day. Nearly every American gets more than this. It's really not difficult to get a lot of protein in your life, even if you're a complete vegan. For example, using this calculation, for a 150-pound person, you need about 50 grams of protein a day. The average American consumes over 100 grams per day. This concludes the presentation on chronic kidney disease. I hope you found this helpful. If you have questions or concerns, please feel free to message me through the portal or set up a visit in the office or by telemedicine. Take care and good luck.